Planning for going home. Two things to keep in mind. Who's going to be preparing your meals for you? I will tell patients to cook an extra portion of a meal, put it in the freezer so they have that for future use. And then my favorite picture here is clutter in the stairs. I want you to keep in mind that when you go home, you're probably going to be using a walker. A walker is about 22 inches wide, so you need to make sure you have a nice clear path to get any place you need to go in the house using that walker. So you want to clear up your electrical cords, get those out of the way. Make sure your phone is charged so you're not trying to get quickly to a phone that's maybe located on the wall or the side table. Now, when you start thinking about what am I going to do after I've spent my 3 days in the hospital, these are some things to consider when you're choosing home or subacute rehab. There is a criteria for discharge to home, and there is a criteria for discharge to the subacute rehab. Whichever criteria you meet will help determine which plan you're going to have for when you leave the hospital. If you have some major medical issues that are perhaps not managed to our satisfaction after surgery, we may recommend a subacute rehab, or in very rare cases, a medical rehab unit, and I'll explain those differences a little bit later on. If you live alone, generally we'd like to see you to go to a subacute rehab. You need a dependable person to help you when you're at home. Many times we have an elderly couple and they're barely able to take care of themselves, let alone take care of the responsibility of caring for another person who just recently had joint replacement surgery. So that's another consideration. The physical layout of your home is a big determinant. If you have a major flight of stairs to get in and out of the house, that may take into consideration whether you're going to be going home or to a subacute rehab. The physical layout of the home, by that I mean if your only bathroom is up on the second floor and maybe your bedroom is downstairs, it sounds like a crazy arrangement, but I have had patients who've said that's just how my house is set up. So that's going to be a consideration. And then of course your insurance coverage will help determine whether you're going to be going home or to a subacute rehab center.